Okay, we're doing a little video. I have to take advantage of having my sister here with me. So this is Angie. This is the one I've talked about on the blog. And I just wanted a little quick video so you guys could meet her and ask her a few questions about what she's going through, especially for those of you that have talked to me that have loved ones that are also going through some of the same things or themselves. I've had some really great patients that I work with that always ask me about my sister, and they don't know her, but they are always thinking about her, and I have a lot of my great friends that are always praying for her. So anyways, I wanted to do just a quick video. So Angie,
Yeah.
so why don't you tell them a little bit about your kind of cancer and your treatment and what you've been going through.
Okay. I have, it's called non-small cell adenocarcinoma of the lung. Got it. Non-smokers get it. It's non-smoking lung cancer. So it's not caused by anything that anybody knows about, really. There are some speculations, but nobody knows why. I certainly didn't do anything that you would think would cause cancer. Took care of myself, ran marathons, everything else, but just really bad luck. My treatment is, I was kind of lucky because in a way, I mean, it's lung cancer is one that they can't cure right now. But they have new therapies which are called targeted therapies, and it's basically just a pill, a chemotherapy pill that I take every day, and it targets the cancer cell specifically. So the goes to the cell and it kills the kind of what's feeding the cell, cuts off the blood supply so those cells shrink, and so far it's been good. My second PET scan was much improved. A lot of things have shrunk. A lot of the spots in my bones are almost not there. So it's as good as it can be.
What kind of side effects have you had from the drugs?
Mostly, it's the biggest side effect has been the rash on my face. I still have some that won't go away no matter what I do. It was really bad, and then they cut the dose, and that helped a lot because I had even like rash on my head and everything. But I just have the rash on my face, and then my hair is thinning, and my hair is dry, and my skin is dry, and my nails are really brittle, and all that's not normal for me.
Angie's always had like a lion's mane of hair, though.
Tons
She's
of
really
hair,
lucky that way, so hopefully
glad I have a lot to lose.
Yeah.
It's much thinner than it was, but
Yeah. And then what, you are taking some different supplements and stuff too, right, to kind of help?
I get a shot actually at the doctor to strengthen my bones because of the tumors in my bones, and so I take calcium because the shot kind of draws the calcium out of my blood and puts it into my bones, so I take the calcium so that I have enough in my body. And I take vitamin D, I take vitamin C, I take vitamin E. I just started taking biotin to see if it would help my hair and my skin. And I think that's, and then I take iron too. And then I've just been really trying to clean up my diet, using a lot of stuff that you put on your blog, stuff that I read, just kind of picking and choosing what I think is most important. Try to cut soda almost all the way out.
Yeah, I was going to say, what's probably the hardest thing or the biggest change that you've had to do?
I know I've always been pretty healthy.
Yeah, she has.
But I eat a lot less sugar than I did. Not that I ate a ton of sugar, but I don't even eat what I used to as far as sugar goes. I eat a lot less of that, and then I did drink soda every day, and just been drinking water mostly, not soda. Trying to help myself however I can.
Lots of green, like tons of vegetables, right?
Lots of vegetables.
And she does smoothies and just...
Yeah, mostly just vegetables. I hardly eat any meat. I eat a little bit of lean chicken. Mostly I don't like meat, so it really
she'd
wasn't
eat
that
fish
hard,
probably, but doesn't
yeah,
like it.
I just don't like fish, but
maybe we'll get her to like sardines someday.
never happen.
Probably not.
No, but I like vegetables, and I've actually now I crave them. So it is true.
It's true.
It's kind of happened. Kind of crave when I go. Like we went to Hawaii and we ate good food, but I really was craving my own food. Go back to my own food. So I'm trying a lot of recipes.
And what of, like, you've had energy, you said you've still been able to, like, walk, and...
I walk every day.
Small amount of jogging a little bit.
Yeah. I run 3 to 4 miles is as far as I've gone, 2 or 3 times a week. Usually is what I run, but I walk every day, because walking, I don't want to overdo it, and walking is good. And
it's good mentally, too, right?
Yeah. I've been exercising since I got home from the hospital, because I've been exercising for 20-something years, and it's my therapy. So,
yeah. What would you, like, emotionally, like, how do you keep going every day? Like, you've got she's got her 3 kids and her husband, and...
I have 3 kids. I think that's it. There's no other choice.
She's a great mom. She's got great kids too. We're lucky to have the church too. She just got a blessing today by our brothers.
A lot of blessings, lots of prayers, lots of friends. People text me every day, and it helps a lot. And when you are faced with the fear, with the not, just knowing you don't know how long you have, and just kind of everything comes in perspective. And not that I do it every single day, but I don't want to waste a lot of days. I definitely don't want to waste them being mad or depressed.
Yeah. That's even been a blessing for me, you going through it, because I try to remember that. I still get mad and honored with my kids sometimes, but I try to remember that we just all don't know when we're gonna die. But
I mean, nobody does, really.
It's a little bit more of a reality check when you know your life might be shortened. And
I read an article. My oncologist recommended it. Actually, there's a surgeon in San Francisco that has lung cancer, and he's about my age, and he got diagnosed, and he writes about how he felt, and then all of it was the same. Just like, you don't know how long you have. What should I do? What should I, should I quit working? Should I not? Should I? Because you don't know. And treatment been going very well for him, and he's actually back at work. But he read something, I think by Ralph Waldo Emerson or somebody. It's like a poem, and it says, "Every day I wake up and I can't go on, but I will go on." And that's kind of how you feel. Like, every day it's kind of like, I can't do this anymore, but I will, and I have to. So I'm going to. And I feel good, which helps. So
yeah, that's a blessing, because a lot of people with the cancer that you have in bones, right, is really painful.
Yeah, I don't have a lot of pain, just a little back pain, but
she still has a drain in her, but that hopefully will be out soon too.
Hopefully soon.
So, anyways, I just wanted to share Angie's one of my heroes. She's been a great sister, and I love her, and I'm grateful that she would do this for me. And if any of you have any loved ones, then we wish you well too. And just it's great that they're still working on cures and better medications, and we're learning more about nutrition and health to support our bodies, so that we can hopefully just help our bodies to fight it. And that's it. Hope you enjoyed this video. Thanks.